portion open in one portion but not in the other, people would flock to the other location. And if you shut down all retail, like I gave the example, in a portion of, say, on one side of Niagara Falls Boulevard, but you kept the other side open, it would cause lots of confusion, and truthfully, we felt lack of following of the rules if it was so arbitrary. We've been looking at, and they've been looking at, even down to like census blocks, to try to determine where these cases are coming from. And if it was specifically associated with a nursing home outbreak or something with an employer, we could say, all right, we're going to lock down that area there. But it's not. Good example is the town of Hamburg. Town of Hamburg, over 200 cases in the most recent week. It doesn't include the most recent days. But I know that when it comes to the nursing home cases, it's not that many new nursing home cases. The cases are elsewhere, and they're throughout the community. And when we talk about 14075, we don't take into effect 14219, which is Blaisdell, or 14085, which is Lakeview. And when you look at those, you'll see, even in those zip codes, you'll see one part of the zip code very high, another one maybe not so bad. So if we actually did that in the reds, you would have had dots of reds and little strips of reds throughout the whole orange section, including multiple potential ones in one town, but it would have been almost impossible to enforce. So the decision was, orange is pretty strict as it is. If you're a restaurant or a tavern owner, you're not happy right now because the indoor dining that you've been able to provide has to close. And we're really trying to do our best to not shut down the economy. As I've said before, economies can recover, dead people can't. But we also don't want to destroy our economy such to the effect that we don't ever recover. I remember what it was like in the 80s, and it was horrible. It took decades for the community to get out of the economic doldrums of the early 80s, and we never want to go back to that situation. But we also have to do what's in the best interest of public health, which is ensuring that we move forward with a strong, comprehensive plan that allows us to address areas of concern, which unfortunately, for as it pertains for Erie County, is more macro cluster in nature.
So if there were some areas that could move into the red zone, would you recommend that for the entire region?
No one recommended moving in the entire region into the red zone at this point. No one did. Okay. Whether it was the governor, the lieutenant governor, or myself, we all feel that there's certain actions that need to be taken. And after conversing as earlier today, the long conversation I had was with the governor, lieutenant governor, Melissa DeRosa, the governor's secretary, who you often see with the governor during his press conferences, Gareth Rhodes, often see with the governor's press conferences, Kara Griffin, the director of intergovernmental relations, local government relations, and I believe Beth Garvey, the operations director for the state, was on. And that's after multiple calls I've had over the last few days with lots of folks, literally testing back and forth with data points with the governor. So it's fair to say that this was not a decision that was made lightly. It was a comprehensive review. No one wants to go in the orange zone. I don't really want to go in the orange zone. It's going to make a lot of lives miserable and people without an income for some period of time. But we have to stem the tide of the increasing cases, the hospitalizations, and the deaths. WBFO, Mike Desmond. Michael, you need to mute yourself if you're still on, *6. We'll move on to WBEN. Is WBEN on? Okay, is there any other media entity that I had not identified?
Hey, Mark, it's Ethan Powers from the B News.
Hi, Ethan. Go ahead.
Hi. Thanks for taking questions. I just wanted to get some clarification on the school testing mandate. You said multiple times over the past few weeks that it's up to the school districts themselves to obtain the testing materials from the state. But I spoke earlier this week with some school superintendents who said that the Monroe County Health Department ordered tests for all school districts and distributed them. And I was just wondering if you have any indication as to why there seems to be a difference between what the school districts expect from Erie County and what the county is actually able to provide.
The school districts are able to order directly from New York State. It will probably be shipped to our warehouse in which we will distribute it then, testing kits, but they've been provided the information. There's a huge difference between Erie County and our testing lab and every other testing lab in New York State, except for the New York State lab and the New York City lab. They're called, the other counties and everything else are called limited service labs. Erie County does not have a lab that's actually qualified by New York State. We have one of the few labs that's actually qualified by the CDC. We have one of those labs that you see in the movies where the people, there's the clean room, only a certain people can go in it. They have to wear the full body suit. They look like they're astronauts walking in. I think there's only 3 people who are actually qualified in Erie County to do that. I can't go in the room, got biometric entry ports. And that's because we're a CDC lab, which means we have to meet CDC qualifications on all tests that run through our lab. And that's why we do significant testing for our testing clinics. Everybody who's an EMT and so forth has to go through stringent testing as well as guidelines where we're overseeing all those tests. And we're not a limited service lab like the rest of the counties have. Niagara County does not have a CDC-approved lab. Chautauqua County doesn't. Monroe County doesn't. Actually, there's no other county that has a CDC lab in New York State. And because of the issues associated with it, we cannot oversee and be responsible for tests that we're not watching, that we're not actually performing ourselves. So we will allow, of course, if the school districts order testing kits through the state, it comes to us, we'll distribute it out to the state or the school districts through our warehouse. That is something we will do. We will take the results, we will put them in the eClair system, but they have to have their own limited service license. It's a different comparison. I've been in our lab, but I can't even get into the clean room sections. I can't, as county executive, I'm not allowed in. Dr. Burstein's not even allowed in because of the stringent requirements associated with our lab. There's a portion of it which would be similar to what others have, and then there's a whole other portion that's not. And we have to be able to meet the qualifications with the CDC lab, otherwise we lose our accreditation. And we do not want to lose our accreditation. It is a huge impact for us. I know people find it, well, why are you different than everyone else? Decision was made a long time ago. We should be proud that Erie County is one of the only CDC labs in all of New York State, because there's only 3. New York City, the New York State lab in Albany, the Wadsworth lab, and Erie counties. But we will not be able to perform all and analyze all the tests, though if the school districts order through the system that they've been provided, it's just an email. They order it from the state. It will be shipped to our Erie County warehouses and will be available for pickup once we have it.
Great, thanks, Mark.
You're welcome. We'll go through one more round. Is WKBW? If not, WIVB? Any more questions, Chris or Dan?
I'm okay, Mark. Thank you. I'm not sure if Dan is on.
Okay. WGRZ, Channel 2?
We're good for now. Thank you.
All right. Spectrum? I think there was anybody on earlier.
Yeah, one more
yes, Erin.
question. What does this mean for the virtual learning centers that the county set up? Do they have to close as well with the orange zone regulations?
Thank you, Erin, for that question. The virtual learning centers do not have to close. They are not considered schools. They are still open. They were at about 60% capacity countywide. They can still accept more. We are following stringent guidelines with regards to ensuring the safety of the virtual learning centers, but the virtual learning centers are still open. If you need to put your child into a virtual learning center, we still have openings, and we ask that you contact your school district, because there are different virtual learning centers in each of the school districts. Every school district has a virtual learning center. They're run by different entities, but we ask if you need to put your child into a virtual learning center, they will still be open. They are operating under stringent guidelines with regards to providing the child care, so to speak. They're not schools, they're basically child care agencies in which they ensure that the children are at least getting their study done virtually. But they are still open. Talk to your school district if you need a virtual learning center. Sandra, do you have any more questions, Buffalo News?
Yes. In regard to contact tracing, we heard from Dr. Burstein this morning that they are still behind in terms of bringing contact tracers on board because of all of the training that's required in order for them to get started, not only with the general contact training principles itself, but also the software system they're using. And we're also hearing from folks who are saying they're waiting up to a week to find out that they've tested positive for the virus. So I'm just wondering if there's any update on where that stands and how soon contact tracers might be able to get answers back to people, especially if they test positive more quickly.
Well, the problem with them waiting for a week on testing positive, and we've heard that too, and we've often reached out to some of those people, and we find out they're not getting their test done by the county or the state. There's still delays.
That includes some folks who are getting tested by the county.
Yeah, we have a 36 to 40 hour turnaround right now on testing from the county. And I have no one. Now, I could say it, I'm not going to say it didn't happen, but my understanding is it's basically a 36 to 40 hour turnaround from when the test was taken, the test was done, and when the person is notified of their positive or negative results. I have heard plenty of complaints about, I went to this private lab, I went to my doctor's offices. I've heard of that, and we understand that those delays still exist. On the contact tracing, we are still in the process of training more individuals. We're looking at also doing more virtual, which in other words, contact tracers don't have to work at a particular location, so that we could bring theoretically more people on and have them spread out across the county, including potentially even working at home. That is all part of it. And we're also relying on New York State and the CompCare contact tracing system to handle some of our cases. It is a lot. We're catching up. I've authorized overtime to contact tracers. I've authorized the hiring of more contact tracers. It's not from a lack of saying, oh, we're not going to spend our way. We're just going to forget about it and I'm not going to worry about it. We're addressing this issue. We are, as you can say, I said over 500 new cases from yesterday alone. We literally went from having 400 cases a week to 400 cases a day in 2 weeks. And it's exceptionally disappointing and distressing. And we're going to work on it to the point where we are back to where I feel we should be. I'm not happy about it. I'll be the first to admit. We have policy calls internally among the county representatives, finding out exactly where we are. And Dr. Burstein knows I'm not happy about it, that would be any delay more than 24 hours for contact tracers. And I've authorized appropriate action so we can reduce that lag to the best it's possible.
Okay, thanks.
WBFO, are you on, Mike Desmond? WBEN? Ethan Powers from B News. Do you have any more questions? If not, I want to thank everyone for participating in today's briefing with regards to COVID-19. This is not a fun time for anyone, I agree with that, but I would ask everyone to count themselves lucky if they have not lost a loved one or have a family member or friend who's very sick in a hospital right now. We have lost too many of our fellow county residents in the last period, much more rapid growth in deaths, and unfortunately we do anticipate that that will continue for some time. That's why the governor and the state implemented the micro-cluster strategy, with the whole county being at least in yellow and a good portion of the county being in orange. I take no joy in this. I also take no joy in having to read the reports of deaths on a daily basis, knowing that those are loved ones, including younger people who were planning on holiday gatherings, were planning on being at their family's house for Thanksgiving or Christmas or Hanukkah or Kwanzaa. And now their families are going to be in immense pain as they've lost a loved one at a period when we could have stemmed the tide, but for some reason this community, we just weren't able to do it. We have to do it, folks. We have to be better. When you're out, wear your mask. If you've got it, bring it with you. Bring your hand sanitizer. I bring my hand sanitizer everywhere. I do go to supermarkets still. I get in there, I'm bringing my hand sanitizer, and I'm cleaning off the cart. We've got to be smarter about how we do it. We love getting together and watching the Bills. It's fun when you do that. But we know that there's transmission between individuals who are attending Bills games parties. Thanksgiving's coming up. Please, I am imploring you, do not bring together people you haven't been around. Have Thanksgiving with your immediate family. You want to be able to celebrate future holidays with your family members and not have that empty seat at the table like too many of our fellow residents will have in the next years because of what happened with regards to COVID. So once again, on behalf of all of us, please follow the rules, wear your mask, be a good neighbor to each other. We wear our masks not only to protect ourselves, but to protect our friends, our family, and even people we don't know. And if we do that, we will all be better for it. I wish everyone good tidings, be well. We will, of course, have a more comprehensive report tomorrow as we are going to bi-weekly on Monday and Thursdays. So we'll be providing more data tomorrow with regards to mortality and other information. But be safe, be well. This is the holiday season. Let's all get through the holiday season as best as we can by following the rules so that we can enjoy further holiday seasons in the future. Thank you, everyone. Thank you, Karen.